Hello, everybody. Thank you to my colleagues and to the panelists. Good day. I want to talk about testing plans. I know that our CARES Act did require the states to have a testing strategy and testing plan in order to get certain of the CARES money. I've been trying to convince my county, we have 1.5 million people here, to also have a testing strategy and plan. What they did initially was they've set up different locations in the county where people can drive up their car and get tested. And originally it was if you had symptoms, and now it's they keep changing the criteria. Here's my question: a couple questions. Do you have is there a plan in place or that I could refer them to as an example of a good testing strategy that maybe they could look at and then maybe tailor the what our county, some of the things about our county, and in I know I've heard what the ideal is, the $5 million tests a week. Looking at what's realistic now, do they pull off, do they shut down the testing sites that are testing anybody and just focus on the nursing homes and the critical areas? I mean, what do you suggest for them? Anybody, whoever wants to answer this.
I'm happy to answer this if that's okay with my co-panelists. We released a plan yesterday, which it precisely provides local guidance, including helping people think at the level of the county, and I'll share that afterwards as well. But in brief, every local health authority, that is often the county authority, should be building a testing plan based on the number of deaths per day, a sort of rolling average of deaths per day in their area. Deaths per day are the most accurate way of actually judging prevalence, because if you have low levels of testing, you can't actually tell how many cases you have. So you have to actually count deaths. And then we have a formula that you can use to calculate the amount of testing you should be doing. To get to that volume of testing, you have to run a contact tracing program. That is the way you get to the volume. So every time you have a positive case coming in through the patient process or any of your other testing modalities, you want to connect that to a contact tracing program that's finding the next 10 people to test, finding another positive, finding another 10, and so forth. That's where the volume comes from, is from the contact tracing. And so to a point that was made before about how do we actually do this in practical terms, hospitals and clinics, health clinics, have been doing the testing of patients. And so the problem, our organizational challenge, is that we need an equivalent structure to do testing of contacts. And that is really where federally qualified health centers come in and have a very special role to play. And there are other kinds of community organizations that also have a very special role to play in terms of doing that contact tracing. But that's where people should really see clearly. It is about standing up an organizational structure that this country has not previously had. That's where the big lift is. That's why it's so hard. But being very clear about what it is, and you have perfect clarity. Your point about every county should have a health plan is exactly right. And the key thing to know is like who in the county should be the owner of that plan. That's the question that has to be answered that hasn't really yet been answered.
So do you think this general testing, which, we have a site in the north part of the county, the south part of the county, the east, the west, people come up in your cars, is that the wrong approach?
So that's a part of a solution. So you really need multiple sample collection modalities. You do need easy access points. So anybody who thinks they have an exposure or a symptom can go. And you need community messaging that encourages people to go. That's like do-it-yourself contact tracing, okay? And we want to activate that do-it-yourself contact tracing alongside the sort of formal organized contact tracing, just to maximize the number of potential exposures who are getting into the testing process. So yes, you could have sites like that. You could have mobile testing labs. There's a difference between what you want in low population density and high population density locations. So 7 different modalities. And it's like each place needs to understand its needs specifically in relationship to those 7 modalities.
Thank you. And real quick, the antibody testing, does anybody see any value in that?
There is value in it. We're challenged, and I should let Megan speak to this question. We're challenged on the quality of the tests, but if we could get high quality, we absolutely need it just to understand prevalence levels. But Dr. Fitzpatrick?
Yeah, so I would agree with Dr. Allen that the tests are really great at the population level for answering some questions about what the level of infection has been historically, but they are simply not sufficient right now to tell us anything about the people who are protected or who could be protected following a coronavirus infection. We don't really know if the antibody levels correspond to protective immunity, and so we have to be very careful and cautious about how we interpret it. Again, a great public health tool, but not a great individual health tool at this moment.
Thank you. I yield back. Thank you.